Hello, my name is Diego Castaneda, and this video will present a rather very delicate and hypothetical dilemma on very aggressive treatments that could very well be futile in the pediatric population. It's based off of a real-life scenario I had encountered at a prestigious magnet hospital at downtown Chicago, and the names of the patients are placed to ensure anonymity. John is a 10-year-old Filipino boy who is mentally delayed and was admitted to the hospital for a really high fever related to his systemic fungal infection that had spread through his lungs and various parts of his body, including his tongue, which is now black. He also has aplastic anemia and a form of bone marrow cancer. Her mother wants everything done for her only child to survive because she blames herself for the sickly nature of the child, because she had him at such a late age of 40, and she sought out one of the few hospitals in the world that performs stem cell transplants, and she understands that the chances of her son to live are very slim. You are the child's doctor, and it's up to you to make the best medical and ethical decision for the child's future. In order for bone marrow stem cell to be successful, you need to prepare the child's body to readily accept the treatment. Like any form of transplant, you have to have the patient undergo immunosuppressive therapy for the body not to attack itself once the transplant is complete. In doing so, you will make the patient very sick, so you have two options. Have the child undergo immunosuppressive therapy on top of his already febrile body and get a slim chance of him living, or you go ahead and deem this as futile treatment because there's a slim chance that the child will die with a more painful death, so you can just ask him to painlessly die in hospice care. Through the utilitarian, ethical, philosophical lens of John Stuart Mill, this scenario will be solely based on the possible outcome that the child will live, so the doctor will be positive that it's worth the shot. According to Chamberlain University, the principle of utility is meant that principle which approves or disapproves of every action whatsoever according to the tendency which appears to have to augment or diminish the happiness of the party whose interest is in question, or what is the same thing, in other words, to promote or to oppose that happiness. In this case, happiness would be the child's chance to live, and that is the priority. Death is not happy in this situation, therefore it is not an option. This is heavily reliant on ends-based ethics, that even though the child will undergo excruciating pain and can die from the pain, it's still justified that he will do the treatment despite the treatment only having a slim chance of working. Immanuel Kant's ethics, on the other hand, of the categorical imperative states that this act would probably be unethical because you're making a sick child even sicker. In his second formulation, one should always act in such a way that you treat humanity, whether in your own person or in another person, always at the same time as an end and never simply as a means. So the process of which the doctor must do in order to cure the child must be ethical, in that treatment of the child must be done to make him better, not possibly kill the patient due to the severity of immunosuppressive therapy. The doctor must always act as an end and really weighing the predicted possible outcomes as heavier load than the actual immediate task at hand. The utilitarian approach would be the most appealing to me because we are not only thinking about the child but the mother as well. Having to do everything that we can for even the slightest chance that the child will live can make things easier for the mom's grieving process if the child were to die. Or even better, the child may even successfully live and all the pain would have been worth it. Having that sliver of hope can justify the situation, and that happiness is achieved when the medical procedure is successful. It's not necessarily about giving up, but more so having to justify actions of any nature for the greatest good of it produces.